Okay, welcome to Endometriosis 101 class. Let's review the anatomy and remember all the organs in the female genitalia. From outside to inside, this is the vagina. We have the uterus here. This is where the baby grows, the cavity of the uterus. We have two tubes, one on each side, and we have two ovaries. So the eggs start their journey from the ovary and travel all the way inside the uterus to meet the sperm and make a baby. So what happens is that every month you're releasing one egg or maybe more, and it travels all the way here inside the uterine cavity. If the egg meets the sperm, then there's going to be an embryo. This is beginning of life. So how does it work after here? The embryo needs to stick to the wall of the uterus and start growing, correct? Exactly. But let's talk about what happens before this egg actually gets released. Before the egg released from the ovary, the lining of the uterus, which is this lining that you see here, it starts growing up. So day by day, it grows and it becomes fluffy. The linings becomes fluffy and like a velvet lining because it's getting ready. So if you end up getting pregnant, there is a nice fluffy bed for the baby to grow, for the embryo to grow. So now if we get pregnant, this embryo can latch into this wall and start getting fed from this wall and keep growing and growing and growing. So we need to have this endometrial lining before the pregnancy happens. Now, what's the problem with this? And what is endometriosis? If you get pregnant, well, you got pregnant and 9 to 10 months after that, you're gonna have the baby. What happens when you don't get pregnant? When you don't get pregnant, this lining sheds. That's the period. So the lining starts coming down, and that's basically the shedding. That's the period. Now, what's the issue here? This period can also go backwards. This is the strongest theory of endometriosis formation, is that this period going backwards inside the abdominal and pelvic cavity, and it can travel anywhere else. So the period blood, which is not really blood, it is endometrial tissue coming backwards here in the tubes and spilling in the pelvic cavity, spilling around the ovaries, spilling around the tubes, and it can literally go anywhere. It can go as high as the liver, even the lungs, in the vagina. It can be anywhere else, and that will be endometriosis. Now, when it goes backwards, it is not endometriosis yet. What happens after that? This process, which is called retrograde menstruation, meaning that your menstrual period, instead of coming down, and also as well as coming down, can go backwards. So retrograde menstruation causes the endometrial tissue, which is your period blood, go back inside the pelvic cavity. So when that happens, this starts sitting around all different tissues. It can sit around the ovary, it can sit around the tube. What happens next month? Next month, more of this goes backwards and sit here. And next month, more and more. After a while, you're gonna have so much endometrial tissue here, which can invade different tissues. Now, imagine you have a piece of bowel here, and this starts invading the piece of bowel, and it starts getting blood supply from it. Now, you have endometriosis in somewhere it doesn't belong, which it doesn't belong. This is the definition, endometrium where it doesn't belong. This is the definition of endometriosis. It could be on the ovary, it could be on the tubes, it could be even outside the uterus where it does not belong. Now, what is the problem with having this tissue here? Well, next time this layer is getting fluffy and the hormones are working on this layer to get fluffy, these things start getting fluffy too. They all get fluffy. And next time when you get a period and this sheds, they start shedding too. And also there's some more retrograde menstruation. So it's a vicious cycle that keeps getting worse and worse and worse. And that's why as we age, this keeps getting more and more and more, and the collection gets more and more. Now, what are the problems that you have? Imagine, whenever you get your period, you start bleeding inside the abdominal cavity too, inside your pelvic cavity too, around your ovary too, and you have the shedding of endometrium all over. First of all, around the tubes, it can cause blockage of the tubes, so it could cause infertility. Around the ovaries, it can cause, the ovary to get adhesions, get cysts, and that can cause infertility too. There's solid research done that endometriosis can end up even in low-grade cancers of the ovary, which is very important as well. That's if you have ovarian endometriosis, and also other kind of endometriosis is a possibility. Now, it's also going behind the uterus, which is the deepest part behind the uterus. We call it cul-de-sac. Cul-de-sac is the deepest part of the sac, which is behind your uterus, in front of the rectum. So this blood collection and this endometriosis collection in the cul-de-sac is going to cause pelvic pain and bloating and pain with intercourse. So I have patients sometimes tell me, you know what, I don't have any other symptoms, doc. The only thing that happens in specific positions, when the penetration is really deep, I have pain. That could be endometriosis. Of course, it's not always the case, but you have to examine the patient to see if she has pain and tenderness in the area that could be endometriosis. Also, I have patients, age of 30, 35. We've been trying to get pregnant forever. Why can't I get pregnant? You check, both tubes are completely obstructed. Nothing can go through that tube. And when you look inside, you see it's all endometriosis that's been building up forever. Sometimes in the stage 4 endometriosis, you have the scarring of endometriosis between the uterus and the tube and the ovary and all over the place, even in lower stages sometimes. So it is very crucial, if you have the symptoms, to see your physician and be proactive about it. What I really care about in my practice is prevention. Because remember, you can treat everything. You know what? I have a headache. You can always treat it and take Motrin or Advil or this or that. But to make sure what's the reason that headache is there. Do I have a tumor in there? Is there something else that's going on in my blood work? Maybe I'm anemic. Maybe I don't have enough oxygenation to my brain. Those are more important things to find out what's the reason behind my symptom. Treating the symptom itself is very easy. You have pain with your periods, anybody can give you Motrin or Advil. You can even take it over the counter. It's going to get rid of the pain. But is it going to get rid of the actual reason? Now, not all the pelvic pains are because of endometriosis. There are different reasons. They could be fibroids, they could be problems in your GI tract, you could have IBS. There are many different things. But we have to be very mindful of our body. If there is a symptom, we have to get to the bottom of it. Thank you for listening.